Hello, Mac Performance family. Welcome to our weekly live. I'm going to go ahead and get the live video up and running so I can see what's going on with everyone this evening. I can't find it. So, tonight we're going to be talking about the TMJ. So if you're watching this live, hashtag live. If you're watching this on replay, hashtag replay. And we're really going to take a dive into how you can manage this joint by yourself. But if it gets really bad, which stress can be a trigger for jaw pain. And if you didn't know, TMJ stands for the jaw or temporal mandibular joint. Fun fact. So we'll really dive into what that is. Now, when I was little, I used to think TMJ stood for tooth, mouth, jaw, which I thought was pretty brilliant. My mother thought it was hilarious because she was a physical therapist that specialized in TMJ. And the fact that her daughter didn't know that it was the temporal mandibular joint, she told all her PT friends. They thought it was hilarious. I still thought it was brilliant. So TMJ, temporal mandibular joint, that is the joint right here, creates our jaw with our mandible and our temple bone. I know, medical, really creative with how we name things. And we will go into what you can do at home and what a chiropractor can do for you. So why does the jaw hurt? Most commonly, it's due to clenching of your jaw or grinding of your teeth, which during the day you may not do. It may completely be a nocturnal thing while you're sleeping. And definitely when you're stressed, that's when it can happen. And I don't know if anybody else is experiencing some stress right now, but definitely having some stress here. Ooh, let's see, we have Denise and James. Hey, welcome to the live. So with the TMJ, where the pain can be, it can really center around here. It can create tension headaches during the day. It can also create neck pain. So are your headaches from your neck? Are your headaches from your jaw? Are your jaw pain from your headaches? A number of things. The other thing that can attribute to jaw pain is having to chew on really chewy foods. So gum can be a trigger, or people who like to crunch on ice. Those things can be very, very bad. I'm gonna put bad, but those things can definitely attribute and contribute to having jaw pain. Now, I have really bad jaw motion when I open and close my mouth. I'm going to fully admit that. Mine is awful. My mother is going to be ashamed when I show how bad it is. And it's really, I think, gotten worse after having braces. And they took my underbite and evened it out so that I have very nice straight teeth. But my motion is really bad. And simply to check motion, you just open and close your mouth. Yeah. Not great. It should go up and down in a nice smooth motion with no clicking or grinding. And when I do it, it goes open really nice, then it hitches and closes with a crunchy noise. It's great. So again, I'll show. Yeah, not good. So, and we have Colin and Karen. Welcome. So right now we're working on that jaw, and I'm just showing some range of motion and how mine is not very good. Now, I don't have any pain. I will occasionally have pain, especially with stress, and I manage it with some soft tissue work. And you can do this to yourself. Now, there's a lot of muscles. So we have the big muscles of mastication, which is the fancy word for chewing. So, Jeopardy question, what's the fancy word for chewing? Mastication. Is our masseter muscle, and that's the one that makes up the most of our cheeks. Our cheeks are mainly our masseter muscles, and what's nice is because it's in our mouth, we can actually stick our hand in our mouth and pinch our cheek and then just open and close, and that can help release some of the muscle tension within that. Oh, I'm sorry. I know my jaw movement is so bad. So bad. So, the other muscle that can be really problematic is called the lateral pterygoid, or what commonly gets nicknamed once you poke it, the lateral terrible. It is a very uncomfortable muscle. It's mainly located up in the cheek, way up here. Now, it's not something you can get except for going in the mouth. And I'm going to grab someone who has a much better range of motion on their jaw. And I'm going to show what you can do to yourself. And I'm just going to demo on him because he's here. So I can keep talking without having a finger in my mouth. So Andy's going to bounce over and join. And I'm just going to simply put on some gloves because I don't want to stick my finger in his mouth without gloves on. So first show your range of motion, what it should look like. Yeah, so nice. Mine is so bad. It is so bad. So I'm going to stick my finger in his mouth, outside of his cheek. It's going to close his teeth. I'm going to go up into right about here. And you know what? It doesn't feel good. And you just hold pressure. And really, if it's not an issue, it shouldn't hurt. But when it is a problem, it's very uncomfortable to have this done, which is why he's making such cute grimacy faces. And he does have some jaw issues. He's a clencher. So this is something that just really helps alleviate the pain and alleviate some of the headaches. Now, this is something you can do to yourself. I advise doing it in the shower because it can make you rather drooly. And that's where, if you're already in the shower, it's not an issue. Sitting up can be a problem. Now, if that doesn't take care of the jaw pain, it really could be an alignment issue. And that can be taken care of by a chiropractor or a physical therapist. So, how a chiropractor would take care of that is by getting on the outside of the jaw and simply open it just a little bit. Simply working the joint in different directions just to kind of loosen it up. We can also push inferiorly and just kind of working in this area here. We then can also mobilize by sticking our thumb into the bottom and simply tractioning. Really, we're mobilizing, we're not necessarily adjusting. And that can really help kind of decrease some of the pain and dysfunction of the jaw. But really, the key thing is working the muscles and stopping doing aggravating things. So things you can do at home. Work on the muscles out here, the masseter up here with the temporalis muscle, and then again inside the mouth up into that lateral pterygoid. Best thing I can say about the lateral pterygoid is this: when you'll know when you have it, when you don't like what it feels like. It is an uncomfortable sensation. The other things you can do if you are grinding and clenching your jaw at night is get a mouth guard. Get something to sleep in to prevent that. Because if you clench and grind, you can actually break your teeth. Ow! And damage and expose nerve roots. So you really want to make sure that you're wearing a night guard or a mouth guard, whatever is most comfortable. And those can be either purchased and then fit, or have them custom fit at a dentist or periodontist. It's a big name for a fancy dentist. And they are able to custom fit that to make that work for your body and help it fit so you can sleep through the night with it in. Other things you can do during the day, if you're one of those people that while you're working and things are getting more stressful, you start just clenching and grinding, is you can cluck. So just that automatically releases all the muscles. Just You can't clench when you do it. And that right there can just alleviate the pressure that you're starting to build. So the minute you consciously acknowledge I'm clenching, cluck, just fixes the problem. Now, the other thing is chin retractions. And that's simply where you're going to make a lot of double chins. The more double chins you create, the better. So you don't want to put your chin to your chest. You want to retract it back. Super sexy double chins. All the double chins. So again, you're just retracting back. You're going to feel tightness in the front. And it's actually going to alleviate some of the pressure in the back. So that's a really nice just way to alleviate some of the muscle, some of the issues, and create some better function within the jaw. Now, again, is having a perfect motion ideal? Always. But again, mine is horrible. Absolutely awful. It clicks, it grinds, it jerks around. But it doesn't cause me any pain. And the only time you notice it is when I'm going to full motion and full closing. Now, if I sit and chew gum all day, if I had a really tough steak and I was chewing on it, yes, I can have some discomfort. So I'm just very cognizant of what's going on and try to prevent having any issues. Do we have any questions tonight concerning anything? Jaw or back or neck, but really tonight was a focus on the jaw because I know I keep getting some messages concerning some jaw pain and stress right now. And I just wanted to make sure that you had the information on how you could treat some of the muscles, what exercises you could do. I see we have a bunch of people on. James, Colin, Karen, Pam, Jeff, Christy, welcome. I like doing these lives to try to help promote and get people the help they need to kind of take care of themselves, especially right now, because you're kind of at home all the time. At least we are all the time at home. If you're watching this, hashtag live. If you're watching this on replay, hashtag replay. I am very much appreciative of all the people who have joined me on our live videos and have helped with some low back pain and knee pain, neck, headaches. If you have a topic that either we've already covered and you want different information on because it didn't quite apply to you, or you have a topic that we haven't covered at all, go ahead and comment down below for next week. So helps come up with topics. A lot of times I'll get a private message sometime during the week, and that is where we build the content for our lives so that it's specific to what you need. This week we have a blog coming out on Friday, and we're going to be covering telehealth and what telehealth is and how it can help you. See, we have a question. When should a trip to a doctor be the next step? I.e., I might have broken or fractured part of my jaw. Ooh. Okay. Yeah, so big things are, if you have a suspected jaw fracture, that is a 911 ER visit kind of thing, and usually is associated with a massive trauma. Being punched in the face, getting hit in the face with a hockey puck, maybe crashing into a wall. The jaw is actually a really, really strong bone, and it's kind of hard to fracture. But key things that would be signs is you wouldn't be able to open and close your mouth. You'd have trouble talking, and there may be a malalignment where the actual alignment of the jaw might be crooked. Jaws are more likely to dislocate than fracture, and if that happens, again, 911 ER. If you're simply just having jaw pain, maybe because you woke up feeling funny, that's where the tips and tricks we talked about in this video concerning working on the muscles and doing the exercises are a huge benefit. I see we have another question. Would you recommend a soft food diet when they're in pain? Diet modification. Potentially. Absolutely. If you're having such significant pain and locking while eating, then moving to a soft food diet may be a huge benefit. But if you're in that much pain, that's when you need to get in and be seen and actually have someone assess and treat you beyond what you're doing at home. Jaw pain should not prevent you from eating, but if you're, again, having such significant pain that you're unable to consume foods of normal texture, that's what you would do. Good foods for that would be smoothies are great, soups, applesauce. I personally like pudding, but that might not be the healthiest choice. Mashed potatoes, casseroles, if they're a smoother texture, might be a benefit just to help kind of keep things in a constant state so you're not having to chew as much. Pastas, mac and cheese is a good one. I always go to mac and cheese. But those type of foods can be a benefit. Again, when you're in pain, we don't want to completely avoid it. We don't want to become fearful of activities, but we may need to move things back and rein things in so that we're not creating so much pain that you're not able to do something. Do we have any other questions? I see we've been joined by a couple other people. Rachel, Liz, Nicole, and Ashley. Welcome to the live stream tonight. It's always nice to have you guys. Again, we've talked about the jaw, what you can do at home with some soft tissue work. So just some gentle massage techniques you can use for yourself and some exercises, including chin retractions. And when knowing that you're clenching your jaw, simply clucking to eliminate the pain. And you know what, Rachel? Yes, we are in Minnesota. I'm still not going to call it a hot dish. I am not going to do it. It is a casserole. Just because you're wrong. I'm just saying. It's a goose, not a gray duck. Oh, God. You're going to lose one. No, I'm not. All right, another question. Are there any tips for not grinding at night other than a mouth guard? Yeah, that is a hard one. I know some people have issues with using a mouth guard or a night guard at night for grinding. Either they subconsciously take it out in the middle of the night, or when it's in, they find it choking and they're not able to wear it comfortably. Here's what I'm going to say. Try as hard as you can to figure out maybe a different type, a better fitting, a custom fit, whatever you have to do, try to find one that works. If it absolutely is not going to happen, then this is where potentially developing, seeing a counselor or a psychiatrist for stress management, meditation practices, maybe it's a nightly yoga meditation before bed, so you're doing some sleep hygiene to try to reduce your stress so that when you go to bed you don't have the inclination to clench, because typically it's the stress in our lives that is causing the clenching and grinding. That's not always the case. This doesn't always help, but it can be an alternative to having to wear a mouth guard if you just can't do it. The other thing that you can do is utilize acupuncture as a stress relief. We don't offer acupuncture at Mobility, Agility, Chiropractic Performance, but I do have acupuncturists that I refer to throughout the Twin Cities. So if that's something you're interested in, I would happily let you know where you can go, literally wherever you're located. Because you know what? Acupuncture is surprisingly good at taking care of sleep and tooth and jaw grinding issues. That's typically when mine starts to act up. It's honestly the first place I go. Go get my acupuncture, have them put the needles in my ears, It doesn't hurt. I have a huge fear of needles. That's usually the first thing people say. I can't go see an acupuncturist because I'm terrified of needles. Well, guess what? I hate needles. They are awful. But acupuncture doesn't bother me because their needles are about the width of a hair. You honestly don't feel them. It's amazing. I see we have some other join in. Hey Liz, hey Megan. Any other questions from people tonight? I know that the jaw, the temporal mandibular joint, TMJ, all means the same thing. Or if you're a little kid like me, the tooth, mouth, jaw, because that's what I thought TMJ stood for. Made sense. I hope you got the information that you wanted to tonight. If you have a topic that you're thinking of and want to have information on it, go ahead and comment below or send the clinic a private message. And this is kind of how we build our topics week to week. This week we have a blog coming out on telehealth and how it can benefit you and what it is. And then after that, I have a blog coming out on should you be a single sport athlete? Yay or nay? It's a big question, especially when you have children and they want to play college volleyball. They want to play college hockey. Should they be a single sport athlete? Let me know what you think. That blog will come out the first Friday in May. I know it's going to be a little bit controversial, but we do have a question. Do you have to have a specific reason to see an acupuncturist? No, absolutely not. They work on so many different aspects. Now, do they diagnose in the traditional Western medicine standpoint? No. They diagnose via Eastern medicine and then can work on diagnoses you've received from Western medicine. What that means is if you go in for anxiety and stress, which is, okay, I'm a high-strung person. I don't know if you knew that. I am a type A psycho. I have a lot of stress, as my gray hair indicates. I go to see my acupuncturist for insomnia and stress management. And then when my headaches occur, I've seen them for my headaches, and I've also seen them for knee pain because I'm an old lady. Now, when I go in for stress and anxiety, they always tell me my liver is invading my spleen. I was like, say what? Pardonnez-moi? My liver is doing, and they're like, no, not your literal liver, your Chinese medicine liver. I'm like, I don't exactly grasp the concepts because I haven't gone through a master's program. I don't have a master's in it. I don't have a doctorate in it. I have just been a patient of it. And it has been an amazing experience. I will say this, there is a difference between dry needling and acupuncture. And if you've had dry needling and had a horrible experience, please do not hold that against your acupuncturist because that is not the same thing. So make sure you go and see a truly licensed acupuncturist before you pass judgment on it. And no, you don't have to have a specific issue to go see them. They take care of a bunch of different things. Oh, we have another one. Hi, Tim. Welcome to the live stream. If anybody has any other questions, we'll hang out for a little bit and just cover those. I have really enjoyed this evening. It's been a lot of fun with the more engagement. If you have a topic for next week, please comment it below. It can be literally anything you want. I know for most of the country right now, we have about 2 to 3 more weeks of being indoors. So this is a great time to find out things on how to work on you. Take the time. You know how many times you say, oh, I don't have time to cook? Now you have nothing but time. Or you don't have time to work out. Establish the patterns and establish the habits now so when we get back to a more regular life, you can get back to movement. So, with that, I'm not seeing any other questions. I want to thank you again for joining me here at the home version of Mobility Agility Chiropractic Performance. Remember, it's always about getting you better faster, keeping you better longer, because no one has time to be sidelined. Have a wonderful evening. To keep up to date with future content, please click subscribe. Additional information is found in the description of this video.
All information, content, and material of this video is for information purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider.